and that's another area to palpate on to see if there's an injury to the growth plate. I've also drawn out the deltoid ligament, which is the medial ankle ligament, which is just below the tip of the medial malleolus, and of course your tendons are coming around the back of the medial malleolus, and you can palpate on those as well. So for physical exam of the ankle, just like every joint, we assess range of motion first, and for the ankle, the range of motion would be dorsiflexion coming up and plantar flexion going down. For dorsiflexion, sometimes we'll do provocative dorsiflexion where we really stress the ankle in dorsiflexion to see if there's any impingement, and if there is, patients will often get some pain in the anterior lateral joint line right in this area. The second thing to assess for ankle range of motion is hindfoot motion, and we'll check inversion and eversion of the hindfoot, and we'll do that by stabilizing the tibia and moving the calcaneus back and forth to check for hindfoot motion. This is important in people with flat feet to make sure it's not a rigid flat foot. When you look for swelling in the ankle, it'll often appear in the lateral joint line in this area right here, and swelling is the first sign that there's been some injury to the ankle. As we go towards the key physical exam tests of the ankle, we think about the most common injury being a lateral ankle sprain. The way to do a physical exam for a lateral ankle sprain would be to palpate the different areas that you are aware of. So you would palpate the fibula and the growth plate to see if there's tenderness over the growth plate. If there is, that could be consistent with a growth plate fracture. And you would palpate the two ligaments, the ATFL or anterior talofibular ligament and the CFL, to see if there's tenderness over those ligaments. And that's how you'd make your diagnosis between ankle sprain or growth plate fracture. There's also the third ligament to worry about, which is the syndesmotic ligament, which is up there. So you'd palpate on that if you were worried that it might be a high ankle sprain. Some provocative tests of the ankle after an ankle sprain would be to stress these ligaments, and the first way to do that would be an anterior drawer test. You'd take your right hand on the patient's right foot and grasp the calcaneus, and your left hand would stabilize the tibia, the knees flexed, and you gently pull the calcaneus posteriorly and anteriorly. What you're trying to assess here is translation and endpoint. And like any test in orthopedics or sports medicine, you can always compare it to the other side. So I just sort of stabilize the tibia and gently rock the calcaneus and talus anteriorly, assessing for instability in that area. And it's the kind of test you need to do a lot to get a sense of what feels normal and what doesn't. In order to stress the calcaneofibular ligament or CFL, we'll do the talar tilt